Thank you, Presiding Officer. To ask the Scottish Government what its response is to the findings of Audit Scotland's report, NHS in Scotland 2024, that the Scottish Government have no clear plan to deliver its NHS vision.
Cabinet Secretary Neil Gray.
Thank you, Presiding Officer. I thank Audit Scotland for their report, and I agree that reform is essential. I've already acknowledged such in my vision for reform, which I set out to Parliament in June, that given the scale of growing demand that our health and social care services face, major reform is required to ensure sustainable health and care services. We are already developing and making good progress on new models of care and exploring how we can further improve productivity through innovation, technological advancements and workforce models that will directly respond to the challenges in our system. This year, we are providing more than £19.5 billion for health and social care, but we are determined to continue to improve our health service, and the budget we set out tomorrow will throw the weight of the government behind performance improvements and ensure we can tackle the challenges in our health service.
Brian Whittle.
Presiding Officer, this is the second time in 9 months that Audit Scotland have warned the Scottish Government that Scotland's NHS is failing on their watch. With no clear long-term plan and unsustainable spending, we have the worst A&E record waiting times. 1 in 6 Scots are on an NHS waiting list, the lowest life expectancy in Western Europe, record drug and alcohol deaths. When we were promised action on the mental health crisis, his government slashed £20 million from the budget, and we were promised an end to delayed discharge. It is at record levels. The list goes on and on and on. Limitless promises bringing little change. Ever greater spending, ever poorer outcomes. Endless directives, Presiding Officer, but no direction. Change has got to come, and the first step is making a change is recognising it is needed. So will the Cabinet Secretary accept that his government's attempts to fix the NHS aren't working?
Cabinet Secretary.
Thank you, President Officer. I thank Brian Whittle for his question. I've already said that I accept and agree with Audit Scotland that reform and improvement is needed. I'm not just saying that today. I said that in June. I said that when I first took office in February. And we haven't been waiting in order to see improvements and reform take place. We are in a national conversation with our clinicians, with our staff, with our trade unions, with patient organisations, in order to inform how we shift the balance of care. Because I think all of us are clear, I'm certainly clear, in the direction of travel we need to go in. As I'd set out in the response to the topical question, it is about shifting the balance of care from the acute sector into primary and community care services, moving where we deliver care closer to people's homes for the reasons that Mr Ross set out in his question. I think we're all in agreement around that, and we now need to make sure that we get on and deliver it.
Brian Whittle.
Presiding Officer, I have heard that answer every single year that I have been in this Parliament. Do you know, if I sound angry, it's because I am, and it's because the public are too. They're tired of hearing about record investment or by what metrics Scotland is doing better than England this week. They want an end to ATM queue on the GP surgery phone line. They want to know that the waiting time for treatment won't be measured in months or years, and they want to be confident they have a government with a credible, focused and achievable plan to give them a sustainable NHS back. Scotland needs a long-term strategy, Presiding Officer, or at least a clear strategy. And the solutions aren't a mystery. We've been talking about them in this chamber for as long as I've been here. Reducing preventable illness, investing in technology to speed up treatment, reform to get rid of unnecessary bureaucracy and wasteful spending. Will the Cabinet Secretary agree with us on these benches that it's time for his government to focus and deliver the meaningful reform and strategy needed to improve outcomes for patients and healthcare professionals and give Scotland back the national care service it needs and deserves?
Cabinet Secretary.
With respect, we are doing just that. We've set out £30 million this year that is generating tens of thousands of new appointments to get waiting times down. I announced just last week a further investment to go into general medical services, recognising the investment that's required to take place to shift that balance of care that I'm talking about, and the work on adopting greater innovation. That is already happening with the likes of the ANIA programme and the work of the Chief Scientific Officer within government. There are examples of good work happening across government and our health service to deliver on the aims that I have already set out, and tomorrow's budget will see an even greater investment to ensure we can continue to deliver that.
Thank you. Before we move to supplementaries, there are many requests. I'd be grateful if we can keep questions and responses concise, such as the level of interest. And I call Jackie Bailey.
Audit Scotland last year said the SNP had no vision for the NHS and was not delivering. This year, they're forced to repeat themselves. And not only do the SNP have no clear vision for the NHS, they have no plan. After 17 years, the SNP have weakened the NHS. There has been no effective reform. John Swinney has been at the helm of the government either as Finance Secretary or as Deputy First Minister. He is not an innocent bystander. This is a crisis of the SNP's own making. Record resources are now available, but it needs to be accompanied by reform and political leadership. Talk is cheap. It is action that is missing from the SNP. So, Cabinet Secretary, is it any wonder that the people of Scotland have lost trust in this government to deliver for staff and patients in our NHS?
Cabinet Secretary.
We have, as I said out in response to Brian Whittle, we've already started those investments in driving down on waiting times, on shifting the balance of care into primary care. And in terms of our vision for a health service, I set that out very clearly to Parliament in June. We're now in a process of conversation with patient groups, with medical professionals, with clinicians and others around how we ensure we deliver upon that. And tomorrow's budget is going to set out a clear direction of travel in terms of how we will invest in the NHS in Scotland. The challenge for Labour is the resources that are going to be going into the health service is whether they're going to support it or see those resources stopped because they vote down a budget.
Thank you. I call Claire Haughey.
Thank you, Presiding Officer, and I refer members to my register of interests. I am employed as a bank nurse by Greater Glasgow and Clyde NHS. I think we can all agree that to ensure our NHS thrives, reform is crucial. Can the Cabinet Secretary please advise what steps the Scottish Government is taking to progress reform and improvements, and what engagement is underway with key stakeholders?
Secretary.
I thank Claire Haughey for her question. I've set out that we are currently in a conversation with clinicians, with trade unions, with the patient groups and academics on how we make sure we deliver upon the vision that we've set out, which is shifting the balance of care from hospital-based services further into the community. We're not waiting for the outcome of that conversation. As I've already set out, we are investing on relieving the blockage on waiting times that have been built up through the pandemic. We've started that investment. Further investment will come in the budget. We are investing more in primary care services, as was evidenced by the money that I was able to allocate to general medical services last week, and will continue to work with local partnerships on relieving the pressure that has been built up in social care and delivering higher rates of delayed discharge, which is unacceptable, and we need to see greater reform within social care. That is for a conversation to be had across this Parliament on how we make sure we realise the ambition and the expectations that service users have on us on delivering national standards for those within social care. That comes forward through the National Care Service Bill.
Edward Mountain.
Thank you, Presiding Officer. This brutally honest report shows the ineptitude of this Scottish Government when it comes to our health service. Given that NHS Highland have to borrow £50 million a year to keep afloat, will the Government ensure that they continue to get that money, or will they just accept that elective surgery will have to be binned till they've got enough money to do the job?
Thank you, President Officer. I thank Edward Mountain for his question. We have, in this year's budget, allocated a real terms 3% increase to health boards to deliver local services. I recognise even with that there are pressures being felt across the country, and Highland is one example where there are pressures and resource pressures that need to be contended with. We plan within the budget that will be announced tomorrow to continue our record of investment within our health service and ensure that our health boards are resourced to meet the needs of the people that they serve.
Alex Cole-Hamilton.
Thank you, Presiding Officer. We know from this report and others like it that our NHS staff are overwhelmed. They're on their knees and hospital activity levels just haven't recovered. Today, we've learned more people are stuck in hospital than ever before because the care system is broken. That's more than 2,000 beds that can't receive elective surgical patients, admissions from A&E, and that's why our ambulances are stacking up outside our hospitals. So with the health and social care system going backwards by any metric of this government, will the Cabinet Secretary, admit that the 3-year-old NHS recovery plan needs to be completely rewritten?
Cabinet Secretary.
I accept that we need to see reform and improvement coming through our National Health Service. We've set that out in response to Audit Scotland's report today, and we have very clear areas of investment and prioritisation that ensure we can continue to see waiting times come down. We see an improvement in the situation in accident and emergency, and we see an improvement in the situation regards delayed discharge. Of course, we need to see reform of our social care system as well, which is why we've brought forward the proposals that we have for a National Care Service bill. And those that stand in the way of social care reform need to answer to those service users that are demanding that reform and say, if not that, then what?
Rachel Hamilton.
Thank you, Presiding Officer. Scotland's health service has a very high rate of sickness absence. For example, 10,000 days of work have been lost at NHS borders since 2020, and that's just for mental health reasons. Staff absences are putting pressure on other staff and wider services. Why is your government, Cabinet Secretary, failing these staff and the NHS?
Always through the Chair, please. Cabinet Secretary.
Thank you, Presiding Officer. I, of course, recognise the pressures that many staff face within the National Health Service and across public service delivery. The demands upon them are great, and I recognise that, which is why we have sought to bring forward pay deals that support them and reforms to their contracts, including the likes of a reduced working week that I remain committed to, so that we can see them have better support within the workplace. But the best way of improving the situation for our staff, I recognise, is seeing better performance, because the current situation with regards to accident emergency waiting times, the blockages that there are within our hospitals because of delayed discharge and social care provision are putting pressure on our staff. That's why the investments that we make at the budget tomorrow are designed to support that better performance, and why it's important Parliament supports the measures we take forward.
Roddick.
It's crucial that when we discuss the current state of Scotland's NHS, we also acknowledge the significant increase in demand in the aftermath of COVID. This is still having an impact. Can the Cabinet Secretary advise what action the Scottish Government is taking to tackle pandemic backlogs and reduce waiting times for folk across the country?
Cabinet Secretary.
I thank Emma Roddick for that question, and in answering it, I recognise the incredible work that has been done by staff up and down the country to respond to the pressures that we're facing, and I'm incredibly grateful to them for it. Whether it's in NHS Grampian responding to the critical incident, or indeed in Ms Roddick's constituency in the delivery of services in rural and island communities, I recognise the challenges that they face. In terms of the investment that we're making, to directly answer to, Ms Roddick's question, we've put forward £30 million this year to address COVID-related elective surgery and diagnostic procedure backlogs, and will continue to invest in areas that we can see a reduction in waiting times and an increased amount of activity, so that we can see those backlogs reduce.
And Sharon Dowie.
Thank you, Presiding Officer. Health accounts for 40% of the Scottish budget, yet many health boards areas, including my own in Ayrshire and Arran, can often feel short-changed by the NHS funding formula. Can the Cabinet Secretary set out whether he has any intention of reviewing the NRAC funding formula to ensure resources are distributed fairly?
Cabinet Secretary, where that question may refer to the report under discussion.
I think funding is directly relevant to ensuring that we're able to overcome the pressures that Audit Scotland have referred to, but I'm also conscious of making sure that we also reflect the fact that the spend that we come forward with is effective in dealing with the issues that are being presented, and I'll set out, the Finance Secretary will set out in greater detail tomorrow around the budget how we intend to do that.